A common question I get as a physician is whether I need antibiotics. Should I be taking these antibiotics? Or maybe you've been dealing with some sort of an infection and you're insistent that your doctor prescribes you an antibiotic and everybody is saying no. So let's break that down. My name is Dr. Rashori. I'm a board-certified family medicine physician, and here on this channel, I focus on healthy aging. And I believe that one of the important parts of healthy aging is to avoid the things in our environment that could cause damage to our health and prevent healthy aging in the future. I view antibiotics as an essential part of delivering modern healthcare to individuals. However, I also believe that because they are so effective at diminishing symptoms, they're slightly overused and, of course, as we say in medicine, abused. Common times when somebody will take an antibiotic is when they have a urinary tract infection, a sinus infection, a cough, and they have a rash, and they have maybe vaginal symptoms or even some urinary symptoms in men, such as prostate issues. So these are the most common times that we will take an antibiotic. Unfortunately, most of the time, even with these indications, the antibiotic is not quite necessary, and it creates problems down the road. You've probably heard of it, but antibiotic resistance is the biggest one. To me, a more important issue is that we're introducing an artificial chemical that is changing the way our bacteria behave with each other. So we got protozoa, we got fungus, we got bacteria, we got virus. And when we decrease the amount of the bacteria, something else might overgrow. Classically, for women who might take an antibiotic for a urinary tract infection, they'll get a yeast infection. Then they'll take a medication for the yeast infection and they'll develop bacterial vaginosis. And that's why we have understood and learned that the flora in our body, the bacteria, sort of need a good homeostasis. They need a good balance. Introducing an antibiotic can be really, really effective when one particular bacteria has completely overgrown. So when one bacteria like E. coli or Klebsiella or any of these common bacteria overgrow, then they can pose a risk to the person. It's when there is a risk to the person that we introduce an antibiotic at specific timelines in certain dosages to help get rid of that. Unfortunately, there are also antibiotics that cause severe side effects that most of you who are not in healthcare will have never heard about. And this is not meant to scare anyone. But for example, we've seen amoxicillin cause kidney issues. We've seen ciprofloxacin cause Clostridium difficile, which is a very bad infection of the intestines. We've seen azithromycin cause heart problems or even lead to drug reactions. Sometimes they call it lupus-like reaction or other types of immune responses to these antibiotics. These are very rare. Fortunately, they're very rare. And there's no reason to not take an antibiotic just because of these fears. But the question I always ask myself and what I try to teach to my health coaching clients is, does taking this antibiotic relieve the symptoms that you're having, or does it get rid of a major problem that is a major health risk to you? If it is the former, then there's probably something else that a person can do, because if you do it this time, you're probably going to need to do it a second time. That's why we see a lot of people with recurrent urinary tract infections, which in reality are interstitial cystitis or painful bladder syndrome or other inflammatory conditions of the bladder. We see people with coughs and bronchitis, which often is asthma or emphysema or COPD, take antibiotics for their symptoms. And they do get better because antibiotics have, through many different pathways, an anti-inflammatory effect. So autoimmune patients will classically tell us, whether in rheumatologic conditions or in inflammatory bowel disease and gastroenterology, that when they take an antibiotic, they actually feel better. Of course, that's not the right way to solve that problem. Usually the proper medication is necessary or lifestyle modifications. So if you're going to take anything away from this, figure out, does this medication truly change the outcome of my health, or is it going to just mask a symptom or get rid of a symptom that I don't like? And of course, that decision is up to you. You should always have a great conversation with a competent physician, clinician, to help you decide that.